Hi, this is Chad Larimore. I'm an associate professor here at the University of Central Arkansas and the chair of the IPE committee. So today I'm going to be talking to you a little bit about concept mapping to get you prepared for the upcoming IPE forum. So we want to start off with just some basics on concept mapping. So the first thing that we're going to talk about is actually what is a concept map. Well, it's simply a tool to visually represent a relationship among a set of connected concepts or ideas. So the whole reason for this is to get you thinking creatively, do some problem solving, help engage you, and encourage your learning. The other big thing though is there are no wrong answers. We're looking for you to be creative, see where things connect, see where things don't connect, and use this as a tool to visually help guide you through the IPE forum. So next, two important concepts about concept mapping are hierarchical structure, so meaning that the most important concepts are at the top and you work your way down, or in the case that we're going to start in the middle and work our way out. The other thing to think about is a priority list, so putting numbers next to them. So what would be the first thing you're going to do with this patient or this population? And then cross links. So these are going to be arrows that are going to link the different concepts together to help you have a better understanding of things that you may have missed on the first go round and really understand how we may be working more together. And so what we're going to do next is show you kind of the basics of what's going to happen. So this is a very general concept map. So we talked about hierarchical, so we're going to start in the middle and we're going to work our way out down different avenues. So this particular example just has 4 starting examples and it can get huge from there. There could be 15 or 16 things that you're looking at. So what we're going to do is we're going to start in the middle with a patient or a population that we are going to be addressing through the case studies in the IPE forum. So that middle box is where you're going to talk about the patient and talk about, kind of who you're looking at. From there, we're going to move out to examination techniques. So one exam, let's say an MRI needs to happen, or maybe a nutritional exam needs to happen here, or another type of exam here. And from there, we're going to move further out along the edges where you can see 4.2, 4.1, and at this point we're going to start looking at interventions. So what would each profession do to help this client along the way? To help make this a little more clear, I have given you a description with an actual patient example here. So for the beginning, we're talking about an 86-year-old female who had a recent fall and now has back pain. So she's come to the physician, to the hospital, to try to figure out what's going on. She also has a past medical history of type 2 diabetes, hypertension, and a right hip fracture with an open reduction internal fixation. So the next step, we're going to move out from there. So then we're going to be looking at what needs to be done with this client as far as the examination. So first of all, maybe some imaging needs to be done. How about vital signs, lab work? So assessment of systems. In my mind, I'm thinking the musculoskeletal system, the skeletal system. And then also, if she's having falls, what about balance and functional assessments as well? So from there, we move out to think about interventions. But like I said, you can't do it wrong. So what I found when I started putting this together is, well, we need more specifics on the examination. So what are we talking about with imaging? So maybe an x-ray just to see if there's a spinal fracture. How about DEXA scan to see if she has osteoporosis? So think about vital signs in labs. Okay, how about glucose levels? Could that be causing the fall? Heart rate, blood pressure, does she have orthostatic hypotension? Could that be a problem? So we move over here to the assessment of systems and start thinking about, what should we be looking at there? So she has diabetes, maybe vision is impaired, maybe sensation is impaired, maybe she doesn't get around a lot, maybe she's weak. So all of these things should be assessed as well. And then moving on from balance and functional assessments, so maybe the Berg balance scale or the dynamic gait index should be employed. And there are numerous others that could be put in this area as well. So maybe a nutritional scan that could be leading to falls as well. Maybe psychological, psychosocial issues could be affecting her as well. So this is unlimited. This should grow and grow. As a physical therapist, this is kind of where my mind went, and this is the beauty of having other people and other professions is that this will grow and you'll see the connections between different professions and what we are doing and to take care of this client. So finally, what I have done is drawn in these connecting arrows. So going from the x-ray to a balance and functional exam. So if she has a positive x-ray with fractures in the spine, that is going to influence this exam. Same thing, what if vision is impaired? So again, that's going to influence balance and functional assessment. So all of these tie in together. So as you think about this, so who's going to be responsible for communicating those x-ray results to the PT or the OT who are going to do a functional assessment? So how does that communication work? So are there overlap here? So can a PT and an OT both do a Berg balance exam? How are you going to work as a team and figure out who is going to do that? So again, there's no right or wrong answer. This is just a quick example of how to get started with the concept map. So what we want you guys to do today at the IPE forum is to take these basic ideas from the concept map and apply it to two different cases. And in the example I showed you, it was a patient. So this could also be a population. So what about screening for diabetes? What about screening for obesity? Things of that nature to prevent things instead of just treating them after they come to the hospital. So when you're looking at these different cases, whether it be patient-specific or population, kind of looking at the big picture, we want you guys to really pay attention to those cross-links. And when you pull the arrows together, think about the interprofessional communication that's going to have to go on. And what are the roles and responsibilities that each one of the team members have? So and how do you optimally work as a team and collaborate to help your patient? And thinking about that, are there places where your roles overlap? And what is the importance of that? And then also thinking about ethical considerations. So just an example, if two people are doing the same exam, so the Berg balance assessment I mentioned earlier, is that ethical for both people to be billing for that? Or would it be better for the patient to have only one person do that exam and maximize their stay and the resources that they have there? So just some things to think about. Hope you guys have a good time, and hopefully this was informative enough to help you get started with the concept mapping. Thank you very much.